welcome. How's everyone doing today?
Good.
Good. So we do have a new addition to our team, so we'll just take a moment to introduce ourselves. My name is Lori, and I'm the social worker.
I'm Carrie, I'm the psychiatrist.
I'm Janelle, I'm the student occupational therapist.
I'm Gabby, occupational therapist.
All right, so today we're here to talk about Joe in preparation for his follow-up meeting tomorrow. So just as a reminder, he's been living with PTSD since his return from serving in Iraq. And his primary goal at the moment is returning to work. However, his symptoms from PTSD are currently getting in the way of that. So we've noticed also that this seems to be a common occurrence recently at our clinic here. So from my understanding, Gabby, you have looked into some research to see what is the most recent best practice.
Yeah, so Janelle and I have been doing some research and actually completed a critically appraised topic to find the best practice interventions that could help Joe. We found 6 separate articles that related best to him, so we're just going to kind of give you a little synopsis of what we found. Great.
Yeah, so the first article we looked at, it was an evidence-based individual placement and support program. And this is compared to traditional Veterans Affairs vocational rehab program. And it was a randomized control trial. The study yielded statistically and clinically significant results. The new intervention showed great improvement in competitive employment rates, gaining employment more quickly, and working more weeks than participants in the vocational rehab program.
I've heard of that approach. It had been used with people who have severe and persistent mental health disorders. Did the study describe who carried out the intervention?
Actually, it didn't specify. However, I would imagine that any trained personnel could implement it, so it's possible that we could try it here as we have a lot of experience working with clients who experience PTSD and other mental health conditions.
Great. We also found 2 studies that actually looked at exposure therapy. So one of them looked at prolonged exposure therapy and compared it to present-centered therapy, which is a more traditional method for helping individuals with PTSD. So the findings found that people who took part in exposure therapy experienced a greater decrease in PTSD symptoms. And they also did a follow-up study which used these same participants, and then they looked at work-related outcomes, and it showed that individuals who had exposure therapy, they actually had a greater quality of life in the work domains. The other one was a small study. It actually only had 1 participant. So basically they had a psychologist who gave 5 sessions of exposure therapy over 1 week, and they did this by simulating work activities and then gradually increasing the stimuli of each session. And this was done until individuals started to reduce their anxiety symptoms and that triggers were decreased. And they completed the COPM with this client, and they found that performance and satisfaction were significantly increased following the interventions.
So as a psychiatrist, I have some experience with cognitive behavioral therapy, and especially for patients with PTSD. And exposure therapy is actually a really useful type of cognitive behavioral therapy, and I think that's something that we could work with Joe together if you would like, and if he would like.
Yeah, that'd be great.
So another one of the articles that we appraised talked about return to work after 9/11, and it found that many of the participants were able to find and sustain employment through their participation in a rehab employment program. So this program allowed survivors who suffered with PTSD symptoms to work through their traumatic experiences in a trauma-focused group therapy program before returning to work. So they were able to work through their problems together. Another article was a qualitative study which provided descriptive first-hand evidence regarding specific occupational therapy interventions that people with PTSD were receiving. So they talked about what worked for them, and this included coping strategies and the occupational therapist partnering with the workplace.
The final article we found looked at a virtual reality job interview training program. And so they just found that individuals who took part in this program actually had improved job interview skills as well as self-confidence in going to that aspect of the return to work experience. So definitely if you have a client that's struggling in that area, it's a very good intervention.
Were all of these interventions specific to occupational therapy? And as a social worker, how could I play a part?
Actually, all the studies included interventions that were implemented using interdisciplinary teams. So none of the participants only received occupational therapy intervention. They received interventions along with other disciplines. So I think it would be definitely beneficial to have all of us working together and being on the same page and making Joe's return to work experience beneficial.
So what's the bottom line of all this?
So it's very clear that OT is a valuable role in working with individuals with PTSD, but there's no conclusive evidence as to what is the best intervention or the best practice to working with these individuals. We found that, some individual approaches worked, whereas some group-based therapies were better. One thing that was very consistent was that it's very important to recognize the trauma and the impact that it's had on the individual that you're working with. So basically, all the interventions had positive results, but more evidence is needed in order to nail down what the best practice approach would be. And so,
So are you able to communicate all this with Joe tomorrow in your meeting?
yeah, definitely. We're going to be meeting with them tomorrow morning at his wife. So
Great, let us know how it goes.
we will.